You're listening to The Resilient Animal. I'm Annie Petersen, Doctor of Education with a Master's in Mental Health Recovery and Trauma-Informed Care. This podcast is an exploration of how helping other living beings can benefit human mental health and well-being, and what makes us all resilient animals.
Animal-assisted therapy, pet therapy, or animal-assisted intervention. Whatever you want to call it, it has a history through science and through my own life. This story is personal for me. It starts in a backyard with a lonely kid and a dog, and it stretches all the way back to ancient civilizations. It's a story worth telling, and a story that started me on my journey in animal welfare. Let me begin with where it all started for me. When I was a child, school was not a place of comfort for many people. The world inside those walls felt very heavy. The kind of heavy that sits on you and makes everything feel like a burden and creates a lot of anxiety. I didn't have many people I could turn to, but there was one presence, one companion who made everything a little more bearable. My dog, Tammy. Every single day, I would head straight to the backyard. That was our place. My dog would be there waiting, tail wagging, completely unaware of grades or social dynamics or any of the things that made my days so exhausting. What I did not fully understand until much later was that we were two souls that found each other. We both needed that connection. I needed something that would not judge me, something that was simply happy I existed. And my dog needed someone to sit with, to be present with, to remind her that she mattered. We healed each other in that backyard, even though neither one of us knew what was taking place. I carried that experience with me, but I did not recognize its significance at first. In fact, I wasn't interested in working with animals at all. It wasn't something I considered as a career path or even a passion. Life unfolded in an unexpected direction, as it often does. I took a summer education position at a zoo. It was supposed to be temporary, a way to fill the summer months, but something happened there that changed the way I saw the world. I started watching people. Not the animals, the people. And what I noticed was remarkable. When someone stood in front of an exhibit, when an animal came close, when there was a moment of genuine connection between a human and an animal behind the glass or across that fence, something shifted. People changed. Their shoulders dropped, their voices softened. Children who would run around excitedly would go still and quiet, although temporarily. Adults who had been distracted would often become fully present. There was a transformation happening right in front of me every single day. People became softer, more focused, more themselves in a way. It was as if the presence of an animal stripped away the noise and the performance and the stress and left behind something more authentic. I remember thinking, this is very powerful. This is something real. And that's when I began to wonder whether anyone else had recognized this, whether there was history here. And of course, the answer turns out is a yes, a very long history. The therapeutic benefits of animals have been recognized and utilized by humans for far longer than most people realize. This is not a modern trend or a recent discovery. This is a practice that stretches back over 1,000 years, possibly longer. There is evidence that as far back as the 9th century, people were already aware that animals could positively affect human well-being. The 800s, While much of Europe was navigating the aftermath of the fall of the Roman Empire, some communities were already recognizing that the presence of animals had a calming, restorative effect on people. And if we go even further back, we find the ancient Greeks. The Greeks who gave us philosophy, democracy, and the foundations of Western medicine also recognized something profound about horses. There is historical evidence that they used horses to improve the overall well-being of individuals. This was not simply about riding for sport or transportation. This was about healing. They observed that the rhythmic movement of horseback riding, the bond between rider and animal, the act of caring for a powerful creature, all of it contributed to a person's physical and emotional health. The Greeks had no formal clinical term for it. They simply knew it worked. Think about that for a moment. Thousands of years without modern psychology, without brain scans, without randomized control trials, the ancient Greeks understood something fundamental about healing. They understood that the relationship between a human and an animal could be medicine. And we're only now beginning to catch up with what they intuitively grasped. Fast forward to the 1600s, and we see physicians beginning to formally apply what earlier civilizations had observed intuitively. Doctors in the 1600s started incorporating animals into their treatment of patients, using animal therapy to address both mental and physical ailments. This was a significant step because it moved the concept from folk wisdom into the realm of medical practice. Physicians were prescribing time with animals the way we might prescribe medications today. They understood that there was something about the human-animal interaction that went beyond simple companionship. It was genuinely therapeutic. Consider one of the most fascinating early examples of organized animal-assisted therapy. In the Middle Ages, in Belgium, there existed programs where pets and people were rehabilitated together. This is considered one of the earliest uses of pet animals for therapeutic purposes. Imagine a community where the healing of humans and the healing of animals were intertwined, where caring for a pet was recognized as a natural form of therapy to the person doing the caring. The animals provided comfort, routine, responsibility, and unconditional affection. And the humans, in turn, gave the animals a home and a purpose. It was a beautiful symbiosis, and it happened centuries before anyone coined the term pet therapy. This idea that animal partners could help people overcome physical and mental health conditions is decidedly not a new one. It has deep, deep roots in human history. Yet, for a long time, it remained on the fringes. It was practiced, but it was not formalized. It was observed, but not rigorously studied. This would begin to change as we move into more modern times. In 1796, something remarkable happened in England. The York Retreat was established, and it introduced a revolutionary approach to treating people with mental illnesses. At a time when people with mental health conditions were often locked away in brutal conditions, chained, beaten, and forgotten, the York Retreat proposed what they called moral treatment. And a central part of this moral treatment was the introduction of animals into the therapeutic environment. Patients were encouraged to interact with small animals, to care for them, to find solace in their presence. The results were extraordinary. People who had been written off as hopeless began to show improvement. They became calmer, more engaged, more connected to the world around them. The York Retreat demonstrated that compassion, dignity, and yes, animals could transform the treatment for people living with mental illnesses. There was a quote that captures the spirit of this movement beautifully. In 1859, Florence Nightingale, the English social reformer and founder of modern nursing, wrote something that still resonates today. She said, "A small pet animal is often an excellent companion for the sick." Florence Nightingale, the woman who revolutionized healthcare, who established nursing as a respected profession, who saved countless lives through her emphasis on hygiene and compassionate care. She recognized the healing power of animals. She saw it in the hospitals and the sick rooms where she worked. She saw how a small animal could bring comfort to someone in pain, how he could lift the spirits of the suffering, how he could provide a reason to keep going. It is worth sitting with that quote for a moment. Nightingale was a data-driven pioneer. She was famous for her statistical analysis of mortality rates. She was not someone given to sentimentality. When she endorsed the therapeutic value of animals, it carried real weight. She was speaking from direct observation in some of the most challenging medical environments imaginable. Let us turn to a figure who may seem unexpected in this conversation, Dr. Sigmund Freud, the father of psychoanalysis, the man who gave us concepts like the unconscious mind, the ego, and free association. Freud had a dog named Jofi, a chow chow, and he didn't simply keep Jofi as a household pet. He brought Jofi into his clinical practice. Freud observed that patients were more relaxed and more open when Jofi was present in the room. The dog served as an emotional barometer of sorts. Freud noted that Jofi would position herself closer to calm patients and farther from anxious ones. He used the dog's behavior as a diagnostic tool, reading the animal's reactions to better understand his patient's emotional state. Freud, one of the most influential thinkers of the 20th century, used his dog as a co-therapist decades before anyone formalized the concept. Speaking of formalizing the concept, consider Boris Levinson. Levinson was a psychologist who in 1961 wrote a groundbreaking article titled "My Dog as a Co-Therapist." This is a landmark moment in the history of animal-assisted therapy. It's worth noting that Levinson faced significant skepticism from his colleagues when he first presented his ideas. Many in the psychology community dismissed the notion that a dog could play a meaningful role in therapy. But Levinson persisted. He continued gathering evidence, publishing papers, and advocating for what he had witnessed firsthand. Over time, the evidence became undeniable, and the field he helped create now spans the globe. Because Levinson didn't simply observe the phenomenon, he conceptualized it. He gave it a framework. He introduced the idea of the human-animal bond as a psychological concept worthy of serious academic study. Levinson had discovered the therapeutic potential of his dog almost by accident. During a session with a particularly withdrawn child, his dog Jingles happened to be in the room. The child, who had been unresponsive to traditional therapeutic approaches, immediately began interacting with the dog. Jingles became a bridge between the therapist and the patient, breaking down barriers that words alone could not penetrate. Levinson recognized the significance of what had happened and dedicated much of his career to studying and promoting the therapeutic use of animals. He is widely regarded as the father of animal-assisted therapy. So now let us go back to the 1940s, during one of the darkest periods in human history. World War II left millions of soldiers physically and emotionally scarred. At the Pauling Air Force Convalescent Hospital in New York, an innovative approach to rehabilitation was taking shape. Dogs were brought in to help recovering servicemen. These weren't trained therapy dogs in the way we think of them today. They were simply dogs, present and available for interaction. And the effect was powerful. Soldiers were dealing with what we now call post-traumatic stress disorder, PTSD, who were struggling with depression, anxiety, and the invisible wounds of war. Found comfort in the presence of these animals. The dogs didn't ask questions, they didn't judge. They didn't require the soldiers to be strong and brave. They simply needed them to be there. And in that simple exchange, healing happened. The formal organization of animal-assisted therapy began to take shape in the 1970s, and this is where the modern movement was truly born. In 1976, a registered nurse named Elaine Smith observed something that many of us have noticed in hospitals and healthcare centers. She saw the positive impact that dogs had on patient morale. Patients who were depressed, anxious, or in pain seemed to brighten when a dog visited. They smiled, they talked more, they engaged with their treatment more willingly. Smith did not merely observe this. She did something about it. She founded Therapy Dogs International, the first organization dedicated specifically to testing and registering therapy dogs. While therapeutic animal visits had certainly occurred before this, TDI was the first formal group established for this specific purpose. It created standards, it created protocols, and it created a pathway for trained therapy dogs to be placed in hospitals, nursing homes, schools, and other settings where they could do the most good. In 1976, it is widely recognized as the birth of the first dedicated therapy dog organization, and Elaine Smith is the visionary who made it happen. Just 1 year later, in 1977, another pivotal organization was established. The Delta Foundation, which is now known as Pet Partners, was created to study the human-animal bond from a scientific perspective. While TDI focused on the practical application of therapy dogs, the Delta Foundation focused on the research. Why does the presence of an animal lower blood pressure? Why do people recovering from heart attacks have better outcomes when they have a pet at home? What is happening in the brain when a person pets a dog or watches fish swim in an aquarium? These were the questions that the Delta Foundation set out to answer, and the answers they found helped legitimize the animal-assisted therapy in the eyes of the medical and scientific communities. The research showed that the benefits were real, measurable, and significant. Interacting with animals reduces cortisol. It increases oxytocin. It lowers heart rate and blood pressure. It reduces feelings of loneliness and isolation. The science backed up what people like Florence Nightingale, Sigmund Freud, Boris Levinson, and countless others had observed for centuries. Allow me to bring this full circle, back to the backyard, where a lonely child and a lonely dog found each other. I knew nothing of this history when I was sitting in the grass with my dog after school. I had never heard of the ancient Greeks, probably knew about Florence Nightingale at this time, but definitely not Boris Levinson. I had no idea what I was experiencing. It had been documented and studied and formalized over hundreds of years. All I knew was that when I was with my dog, the world felt a little less overwhelming. the noise in my head quieted down. I felt seen and I felt safe. This is the essence of the human-animal bond. It isn't complicated. It's not about clinical trials or formal organizations, though those contributions are vital. At its core, it's about connection. It's about two living beings recognizing something in each other. It's about presence, about showing up, about being there without agenda or expectation. Animals don't care about your title or your accomplishments. They care that you are present. And in a world that can feel deeply isolating and judgmental, that kind of unconditional acceptance is profoundly healing. When I stood in that zoo years later, watching people transform in the presence of animals, I was seeing the same thing that healers and physicians and nurses and psychologists had been seeing for over 1,000 years. I was seeing the human-animal bond in action. I was seeing people become softer, more focused, more themselves. I was seeing healing happen in real time, without a prescription, without a diagnosis or a treatment plan. Simply a person and an animal sharing a moment. The history of animal-assisted therapy is a beautiful testament to something we have always known in our hearts, even when we didn't have the words or the science to explain it. Animals heal us. They have been healing us since the ancient Greeks. They healed patients in medieval Belgium and the York Retreat. They healed soldiers in World War II. They healed children in therapy sessions and elderly patients in nursing homes and stressed out college students during finals weeks. Today, animal-assisted therapy programs exist in hospitals, schools, prisons, disaster relief sites, and military facilities around the world. Therapy dogs visit cancer wards, horses help veterans process trauma, cats provide comfort in memory care facilities. Even fish aquariums and waiting rooms have been shown to reduce anxiety before medical procedures. The scope of what began as a quiet observation has grown into a global movement. Today, the reach of animal-assisted therapy is staggering in its breadth and depth. In hospitals, therapy dogs are now a regular presence on pediatric wards, oncology floors, and intensive care units. Some hospitals have integrated therapy animals into their pre-surgery protocols, allowing patients to spend time with a dog or cat before they go under anesthesia. The results speak for themselves. Lower stress hormone levels, reduced need for pain medications, and faster recovery times. Equine assisted therapy, building on what the ancient Greeks discovered thousands of years ago, has become one of the fastest growing areas of animal-assisted intervention. Programs across the United States and Europe now use horses to help veterans process combat trauma, to help survivors of abuse rebuild trust, and to help individuals with autism develop social and communication skills. There is something uniquely powerful about working with an animal as large and perceptive as a horse. In criminal justice systems, prison-based animal programs have shown remarkable results. Inmates who participate in programs where they train shelter dogs or care for rescued horses demonstrate lower rates of disciplinary infractions, improved emotional regulation, and reduced recidivism after release. For many incarcerated individuals, caring for an animal provides a sense of purpose and responsibility that they may never have experienced before. It teaches empathy, it builds patience, and it gives them a living being that depends on them and trusts them. which for some is a transformative experience. Schools have embraced therapy animals as well. Reading assistance dogs, where children read aloud to a non-judgmental canine listener, have been shown to improve literacy rates and build confidence in struggling readers. Comfort dogs are now stationed in schools to help students manage anxiety, process grief after traumatic events, and simply provide a warm presence during difficult days. I, for one, could have really used that in middle school. And in disaster response, crisis response dogs have become an essential part of the support teams that deploy after natural disasters, mass casualty events, and community tragedies. After events like school shootings, hurricanes, and the September 11th attacks, therapy dogs were among the first responders on the ground, offering silent comfort to survivors, first responders, and grieving families. Their presence doesn't fix anything, but it creates a space where people feel safe enough to begin processing their pain. Even in our everyday lives, the evidence is everywhere. Workplaces that allow pets report higher employee satisfaction and lower stress. College campuses bring in therapy dogs during finals week and see measurable drops in student anxiety. Senior living communities with resident animals report that their residents are most socially engaged, less depressed, and even require fewer medications. The scope of what began as a quiet observation, a child and a dog in a backyard, a nurse noticing smiles in a hospital, a psychologist watching his patient open up to a dog named Jingles, has grown into a global movement that touches millions of lives every single day. And they healed a lonely child in a backyard who simply needed a friend. If there is one thing I hope you take away from this episode, it's this. You don't need a formal program or a clinical setting to experience the healing power of an animal. Sometimes all it takes is sitting quietly with an animal who asks nothing of you except your presence. Whether it's a dog resting his head on your lap, a cat curling up beside you on a cold evening, or a horse standing still while you watch him. The bond is real, the healing is real, and it has been real for as long as humans and animals have shared this earth. Thank you for joining me on this journey through the history of the human-animal bond. If you have your own story of how an animal has changed your life, I would love to hear it. You can email us through our webpage, theresilientanimal.buzzsprout.com. And thank you for listening.